Good evening to all and a warm welcome to all homeopathic doctors and students. Today is our 1978th day of uninterrupted daily webinar of IFPH, International Forum for Promoting Homeopathy on 30 Jan 2026. Today's our guest is Dr. Shelly Sharma Bhosale and she is MD, PhD, and ma'am has previously presented several subjects on pediatrics and others. She has been awarded her PhD degree from Defense Minister of India, Sri Rajnath Singh Ji in 2023. She did diploma in IACH Greece, have done advanced homeopathic course from Greece, studied psychiatry and has done fellowship in psychiatry and counseling. She is practicing since 2011. She has successfully treated a wide variety of patients from children to the elderly. She has also helped to reverse and heal for a variety of illness, including incurable and emergency diseases, cancer, psychiatry, and many more. She is running two clinics independently in Maharashtra, India, one in Mumbai, Vasai, and other in Sangli. She has worked as a researcher. She has been publishing and presenting her scientific research papers nationally as well as internationally, Dubai,
So
Germany, Italy, and
let's
many more.
start, Dr. Danish.
Yes, ma'am, you can start your
Am I
presentation.
audible?
Yes,
Yes,
ma'am,
you
you
can
are
you
audible.
can share also. You are the
I
co-host.
think
Right?
I can't.
Yes, you are the co-host. You can share now.
Am I audible?
Yes.
Yes,
Can,
ma'am, you are audible.
can you hear me, Dr. Shelly Sharma? Then there is some problem with you. All of this can hear. That means, do you have another? Please unmute. I
Ma'am,
have.
please unmute yourself, then you can start.
You are the co-host. You simply speak.
Okay, fine.
Okay, we can hear you.
Okay, okay, fine. So, a very good evening to everyone.
Sound is little bit less.
Okay, just one. Okay, am I audible now?
Yes, audible.
Okay, a very good evening to everyone. So, my today's topic is on pediatrics. What is the essence of pediatric prescription? So, this is a very important topic for me, is because, in many months, I'm seeing that many people are very impulsive with pediatric prescriptions. There are many people who use a lot of shortcuts in pediatric prescriptions. And by going and understanding the depth of the child is the very biggest question, correct? So here in my today's lecture, I will be talking about what has to be the essence of pediatric prescription, how you have to go about with a prescription. I will talk about some rubrics. Also, I will be talking about just 1 minute. My activities which I'm doing for pediatric teaching, correct? So, fine. So first I'll start with a case. So I want you all to please paper and pen if possible. I'm coming up with a very, very beautiful case right from my clinic. Here, in this case, I will try to help you to understand how you have to crack a pediatric cases. So when a child comes to your clinic, he will get a lot of things. So many times he is just restless. We think about tuberculinum, we think about maybe calcarea force, but we skip rust tox. Rust tox could be a constitutional remedy, or argentum nitricum could be a constitutional remedy. Also in our clinic, many times when a child is very lovable, he needs a lot of affection, we think of pulsatilla, but we skip lac caninum as a remedy. Some children are very arrogant, very haughty, right? And if there is an issue in the school, and if the girl suffers diarrhea, or if the girl suffers any pathology, and then you come to know that this girl is so egoistic, she is so haughty, And she has a best friend who herself is very haughty. So we end up giving platinum. Maybe this girl is gratiola child. So there are some very beautiful clinical tips I will be sharing with you all. Number one, first we will start with a case. Okay. Now this is a case of chronic LRTI and nasal polyp in 5-year-old child. So she had the boy had a complete nasal blockage. The polyps were blocking 80 to 90% of his both the passages. Along with this child was having repeated lower respiratory tract infection. Okay, so these are the chief complaint. Okay, so the child came with nasal polyps covering 90% of the nasal root, unable to sleep, especially due to obstruction. The child has recurrent lower respiratory tract infection. He has taken a lot of antibiotics. Every 15 days, this child needs some antibiotics. Okay, so his parent specifically said, my child gets up every night at 1 o'clock. Till 4 o'clock, he is awake. He has severe blockage. And then after 4, he goes to sleep. His respiratory complaints are better by standing. He frequently uses nasal spray, recurrent boils on skin. Okay, so nowadays I'm seeing a lot of children coming with a lot of nasal polyp. Have you ever thought why? That is the very biggest question that comes to your head. Why? So little children, so frequent nasal polyps. You know why? See, when a child is growing, when the child is 1 month, 2 months, 3 months old, 1 year old, what is happening with the parent, For a slightest cold and cough, they just run to the doctors and take anti-allergics. For a slightest nasal discharge, they will use drops. So what are we doing? We are suppressing the SORA. At the local level, there is psychosis coming up because we are frequently suppressing SORA. 10, 30, 40, 50, 60 years before, whenever the child had cold and cough, parents used to say, Baba, take this handkerchief, take care of the cold and cough. That was okay. But nowadays, parents are very panicky. Doctors are over smart. They don't care what happens with the child maybe after 10, 15 years or when he grows up, what will be the level of health of the child. They keep on giving a lot of antibiotics, anti-allergics. They give a lot of nasal sprays, right? Which is the leading cause of lower respiratory tract infection. Then what they do? They give a lot of antibiotics. They suppress lower respiratory tract infection. Again, they suppress the SORA, which causes asthma in children, which causes allergic asthma in children. Okay? So the thing is, we have to be aware of a lot of things when we even explain to our patients. When the child comes with a past history, you have to know why this child got nasal polyp. If the past history is very clear, if the child has not taken a lot of antibiotics, lot of anti-allergics, so maybe the root cause is the mother's 9 months of developmental age. And second part is maybe after the birth of the child has gone through a lot of stress. But if the child has been suppressed with a lot of medication, chota mota also it is suppressed, please get into that thing. So your entire prescription strategy changes. Beautiful. The kind of pathology the child has come with, at what stage the child gets the pathology. We come to know a lot of things about the child's past. Where was the child traumatized? What happened to the child? Right now, I'm writing a book on pediatrics. And when I started writing the book on pediatrics, I'm trying to understand childhood traumas. And beautifully, I'm correlating with my patients and I'm seeing how beautiful childhood traumas can be the cause of today's disease where the child is suffering. Correct? So let us go ahead with the case. Physical genetics. Low immunity. The hemoglobin of the child has always been on the lower side. His appetite is very low. desires sweet, chocolate, milk products, strong aversion, no specific. His thirst is very low. Stool is constipated, alternate day tendency to. Urine, yellow, sticky. Sleep disturbed since 1 year. Cannot sleep due to respiratory distress. Sensitivity to amoxicillin. The expectoration which the child gets is not very thick. Now see, everything is very important in a case. If you want to make beautiful pediatric prescription, trust me. If you want to really crack cases where the child is autistic and he has started talking in 6 months, you have to go deeper into the case. You have to understand, you get a lot of symptoms. What symptoms you have to choose and what you have not to choose. You have to understand the psychology of the child. You have to interpret the psychology of the child. You have to work from all these levels. Till then, it is very difficult to crack such kind of cases. Okay, so everything the mother gives, every symptom of the child is very important. Noted. But then you have to decide what I have to take. Past history, recurrent respiratory infections since birth. Father had recurrent fungal infections. Mother had history of anemia. Mental emotional state. Now, so this is the most important part of the case taking. Do not, I would say, don't take this superficially. Children are the creatures which are going to be the adults. If you treat a child well, if you treat and understand the emotional needs of the child well, if you give the right kind of remedy, we have no idea how much we can take care of a child till he grows up as an adult. How many chronic diseases, his predispositions can be pushed ahead. We have a very big responsibility as a homeopathy. Okay, so we have to understand in detail about the mental. Just don't settle the child is restless. Try to find out what is behind the restlessness. Just don't settle the child is weeping. You have to understand why the child is weeping, how the child is weeping, what kind of sound the child is creating when the child is weeping. So with every action, every movement of the child will lead us to the remedy. Okay. Now, this child is also weeping easily if scolded. So this is very important. Many children weep. If you go and open the rubric weeping, you have very lot of remedies, But here we have to think, when the child sleeps, when the child weeps, when he is scolded. So his sensitivity is when the child is scolded. Okay? Very irritable child, especially whenever he is sick. So the mother says, my child is very obedient. He takes care of his younger siblings. He's well-mannered, well-dressed, very good child. When he comes from the school, he will take his food, he will eat himself, he'll keep his utensils back in the sink. A 5-year-old child. But whenever he's sick, he becomes irritable. He has strong fear of dark and strong fear of animals. Highly conscientious child, very good in studies. He will do his all homework himself. Never the parents need to say, Baba, you sit and do your homework. Never. At night, when he's going to sleep, the child will pack his books. He will pack his bags. Okay, so this is so important. At the age of 5, if the child is being very responsible, we cannot skip the symptom. Okay. Now, the child is very timid with guests. He gets highly anxious whenever there are guests. He avoids eye contact initially. He will just go behind his mother. But he likes stable, well-mannered child, well-dressed, not a restless child. He will keep all his belongings neat. Okay? He is very caring. He helps his friends in the school. If anyone is sick, he will take care. If any of the friend has not done his homework or was absent, he will share his needs. Not all the children will do. Narcissus will never do this. Lycopodium will never do this. Graphitis will never do this. Okay, but this child does. Yes, Kali Sulf will do. Let us not go to the remedy. He will also take care of his grandparents. His grandparents, whenever they are sick, the child will go, take care, give him water, give him medicine. Dada, did you take medicines? The mother said, the other day, the grandmother was sleeping without pillow and without blanket. No one said. He just came, he took the blanket, he had put the blanket on the mother, on the grandmother, he gave her a pillow. So this kind of understanding is very important. For that, you have to take a very detailed case. Okay? Very sensitive to parental fights. Since 3 years, parents are just fighting. And he gets very sensitive. And whenever they are fighting, he will go towards the mother. He will be very protective towards the mother. He will wipe her tears, deeply attached. The child loves travel, prefers going outdoors in the evening. Okay? So, the mind with younger sibling, he gets irritated, but he never harms. His younger child is typical Rustock's child constitutionally. He had very bad asthma, completely cured. This child, his younger child, was on bronchodilators. He need to get admitted every year, every month in the hospital. Just with a single dose of Rustox, he was cured. That child always irritated him, but he used to get irritated, but he never hit the child. He never harmed the child. Very understanding. Anxiety before exams, meeting new people. When father is late, he will repeatedly keep on asking the mother why he is not reached yet, why he is late. Okay? Easily hurt if corrected or advised. Now, this is very important. So, mother said, my child, whenever we give him any advice or whenever we correct him, he gets hurt. He will just keep quiet, he gets sulk or he'll start crying. Like, for example, the mother will say, Beta, I think a red color dress will look better. He gets sad. Or Beta, I think, you just keep your books in bag. He gets affected. He gets hurt if anyone corrects him. But this is also very okay. So this was the case of the child. Now you have taken the entire case. Now you have to see in what kind of depth I have tried to understand my patient. This is what you have to try. Okay. Now let us understand the core. What is the child? What he is about? What is my understanding? What is the analysis? So when I saw the child, what I got, which is the analysis, is very stable child, very calm, not restless, not restless. This has to be good. Very timid, yet he is very responsive. Emotionally, the child is very sensitive, easily gets hurt, very caring, understanding, grounded child. Irritability is only when he is physically ill. Highly sensitive to fights, sensitive to reprimands, okay, and on being advised. So this is the core understanding of my patient. Now I want to give him a remedy, okay. So also one more thing I just forgot. He had history of suppressed eruptions. He was repeatedly getting abscess and boils in the childhood, and a lot of antibiotics were given. And those abscess and boils vanished. He got a lot of respiratory issue, and now he landed up into polyps and very bad lower respiratory tract infection. Okay, so the core understanding of the child is what I understood in the case. 1, he is susceptible to polyps, recurrent respiratory issues. I need a remedy. I want you all to please write what kind of remedies, what remedy do you think, what comes into your head. I need a remedy where the patient is highly stable, very deeply sensitive child, very timid, very responsive, caring nature, suppressed emotions, chronic respiratory pathology. So what is the remedy do you think? So this is my chart. This is my rubrical chart. So if you have any, please tell me about it. Anyone has any? Staphycyclia. Dr. Rachita says it's tuberculinum. Okay, very good. Why tuberculinum, Dr. Rachita? You can please type and tell.
Ma'am, as you tell now, the child take care of grandparents. So it shows the precautious mentality at the age of 5 years.
Okay.
So
So
I have read in tuberculinum about that symptom, so I go
very
for
good,
it.
Rachita. But I just would like to correct here.
Okay.
Tuberculinum will not be stable child. When you
Oh,
see tuberculinum in your clinic, you will never find this child very stable, very grounded, taking care of others. Tuberculinum
oh,
precocity, very good. You took is precocity is the rubric, but the
okay.
precocity of tuberculinum is physical. It's not emotional.
Okay, okay,
Okay?
ma'am.
He will
Okay.
grow
Thank
very
you, ma'am, for
tight.
that.
Hmm? And,
Thank you, ma'am, for the correction.
but it's okay. See, this is how we learn, na, Doctor.
Yeah, yeah. Okay.
Someone says staphysigria. Could you please justify me this remedy? Anyone else? Okay. So the chart is here. The rubrics which I took was number one. The child is very timid and bashful. We know that. Okay. We have to take that symptom. Whenever he sees guest coming, he will just hide. We have to take the symptom. Second is whenever he's being reproached, whenever he is being reprimanded, okay, the child cries. Whenever anyone gives any opinion, the child starts crying. So, very sensitive to the opinions of others. Next, very responsible, conscientious, irritability during sickness, history of suppressed abscesses and boil, recurrent LRTI, and low immunity. And this was my chart. Can you see the chart? Is it visible?
Yes, sir, yes.
Okay. So now tell me what remedy is coming.
Art. Uh, 1920. Sulfur. Okay, sulfur.
Hmm? So we have differential remedies: arsenic, calcarea, sulfur, staphysagia, natramur, vanilla, lycopodium, sepia. Okay. Interestingly, staphysagia is coming very close, and someone said maybe the remedy is staphysagia. Okay. Now here I would like to tell that why I did not give staphysagia. The reason was this child is timid, this child is bashful, but he is very sensitive to opinions. Staphysagra child or the parent will never tell that, he's sensitive to opinions of others or he's sensitive to replies. Staphysagra has inner feeling that he's sensitive to rudeness. The difference between this remedy, staphysagra, and minus, staphysagra is highly sensitive to rudeness. Both are well dressed, both are very good, both are well mannered, take care of others. One. Staphysagra, why I did not give again was there is no history of indignation, suppression of emotions. Staphysagra ka pathology wahan se show. It doesn't have. I did not give staphysagra. Okay? So the nearest remedy was coming was natrum muraticum. But I did not give natrum muraticum. I gave the remedy calcarea mu. Why? The major symptom which I found in this remedy was highly sensitive to the opinion of others. And it is here calcarea mu. If you see, this remedy is highly sensitive to opinion of others. Number one, the body language of natrum mur and calcarea mu is very different. Natrum mur will always have a long, thin, beautiful neck. She will always sit erect. Highly conscientious child. Okay. Calcarea mule has features of calcarea. The child didn't had a lot of sharp features. The child in the whole consultation was sitting like this. So what does this show? He needs support. Look at my back. Not this. This is how natrum will sit. This is how ignatia. This is how carcinosin will sit. This is how vanilla will sit. Okay, this is how Lycopodium will sit. But when it is Calcaria mule, we will sit like this. The spine will never be straight. Second, Natrum has more sharp features. Calcaria mule will have more blunt features. So the remedy I gave was Calcaria mule. This was the final selection. And these are all the symptoms which I took. Very sensitive to criticism and opinions, low immunity, recurrent infections, anxiety about family, fear of dark, sensitive child, responsible, precautious, yet he is dependent on others. Tendency towards polyps, glandular infection, lower respiratory tract infection. Okay, and constitutionally, they are very mild, responsible, caring, and they easily get. So let me talk a little bit about Calcaria mule. Okay, should I go ahead with it?
Yes, ma'am, sure.
Okay. So when I gave the remedy Calcaria mule, so what had happened, interestingly, after he took the remedy, the child was very bad. He was just on antibiotics every 10-15 days. He used to get LRTI, his SpO2 used to drop. He had no appetite. After giving the remedy, in a week I got a call, Doctor, my son is having high grade fever, a lot of respiratory infection. And I was like, okay. One thing was very sure, the remedy has worked because he has got an acute back. Now, I had to know whether this acute is because of my remedy or this is a general acute what he gets, which is like acute exacerbation of chronic disease. So I asked him, how is the generals of the patient? Then he says, he's eating well, doctor, since we came to your clinic. He's very active. He was sleeping well. But suddenly yesterday, these all things happened. I said, great. My remedy has acted. He has got his acutes, which is very good. I just gave him Sacrac. I said, wait and watch. He had his fever for 2-3 days and then he was better. And then the child kept feeling better. I just had given 1 dose of Calcaria mule. Within 3 to 4 months, immunity improved significantly. There's reduction of frequency of the infection. Sleep better, no night aggravation, appetite improved, reduced irritability, emotionally more stable. Parents' feedback was there extremely positive. Now, the most important thing here is one thing. When you give the remedy to the child, and when you see whether my remedy is right or not, look at the generals of the child. If the child's respiratory issues are okay, but his generals are not better, somewhere your remedy is not the deepest. Okay, you had to, if you want to give the deepest remedy, the child should feel better as a he has to be more active. His generals has to improve, his motions have to improve. So beautifully, I believe that Herring, Dr. Kent, Dr. Hanneman has given the importance of follow. I can take an entire session on how to take a follow because the follow-ups are very important. They are very deep. You will not be able to take a follow-up till you have a very deep understanding of follow-up. I can teach you a lot of possibilities, how to take the follow-ups, what I can give you a lot of landmarks. Now, this is your remedy is partial similar. Your remedy is similar. What you have to do. If there is an aggravation after you give the remedy, how you have to deal with it. So remember, master follow-ups. Okay? Now, first rule that the generals has to be better. Except for highly syphilitic cases. When you take a very high bad syphilitic cases, maybe the generals will not be better initially, especially if it is a one-sided case. Okay, this is what I last time I had taken a entire webinar series on case taking and follow-ups. This is what I taught all the students, how to take the follow-ups, how to go deep into the case, how to understand what to take and what not to take, what are the strategies, when you should give constitutional remedy, when you should give temperamental remedy, when you should give keynote remedy, when you should give on totality. You can't give same approach to every case. See, your aim has to go and reach the similar. But the approach cannot always be the same. It all depends upon the patient and his entire history. In some cases, if you give a totality ka approach, your case will fail. And if you have to give your keynote ka approach. In some cases, if you just give on mind, it will be a very successful case, but some cases will fail. So what is the case? What is the pathology? You have to understand it. Okay? So this was the follow-up. Now let us see what is Calcarea mure. So Calcarea mure belongs to Calcarea group and Muraticum group. Now, combination of Calcarea, the dependency, need of security, the cutability, very cute children Calcarea are, with a very fragile ego. They are very egoistic, but the ego is not a very deep ego, you know, how platina, sulfurs can. Their ego is, you know what, if they didn't ask me for food, now I will not go and take. They didn't ask me. Chota chota ego. And unko pyar se manaya, if someone will tell very nicely to them, they are okay with it. Typical Calcareas. Okay? So Calcarea muraticum. They are highly sensitive. These children, if you correct them, they get hurt. You know why? The reason is, first of all, they are highly conscientious people, highly responsible. If they get hurt, no, what they feel, you know, that I'm trying to be good. I'm putting a lot of my efforts. It is not easy for me to put efforts. Okay? But still they are finding a mistake. How do I manage other things? And then they get hurt. The ego gets hurt. I have thought a lot because it's Calcarea, you know, for them just to decide what dress they have to wear, it takes a lot of effort. So they put a lot of effort, and they decide upon a dress. And then I'll wear this. And then what happens? The parent, no, you should wear white now. Don't wear black. White looks better on you. Or please keep your books belongings properly. Na Riyadh se. He knows I know everything. Why should I be doing that? Not out of ego. Still, my mother is not understanding how much more effort I can put. And there comes Muraticum. They get emotionally hurt. So slightest opinion will hurt. They are highly responsible towards family. You will always, Calcarea is responsible. When you add Muraticum, Calcarea mure becomes highly, highly responsible. The responsibility is, see, I'll tell you one thing. There are so many remedies in your materia medica who are highly responsible towards the younger siblings. Okay? Now I'm talking about pediatrics today, not the elder ones, because the psychodynamics of children is entirely different than of adults. The thought process of children is entirely different than adults. Okay? So I was talking about Calcarea mure, right? I just got lost 1 second. We were talking about responsible. Yeah. So these children are highly responsible towards family. There are so many children who are responsible towards family, correct? Carcinosin, she is highly responsible. Now, why Carcinosin is responsible? Because she is inborn responsible. It is her genetic trait to be responsible because she is very graceful. She is born in that family. She is born such kind of soul who are very old soul, who enjoy taking responsibility very gracefully. Okay? So when they are reprimanded, they get hurt. Because you know why? Carcinosin will feel, I'm doing everything and still they are finding a fault. My God, what else I should do? How can I make that person happy? They get hurt. This is where carcinosin gets hurt. Like I'm doing everything, but still they are finding the mistake. How much more to do? Oh God, still they are not satisfied. How much more should I do? That's the feeling of carcinosin. Lac caninum children are very responsible. In my clinic, I've seen Lack caninum children, they take too much responsibility of the younger sibling. But the mother will say, doctor, my elder son takes care of his younger son like a mother or like a father. Not also like father, like a mother. They have a lot of maternal instincts, like caninum. It's a very, very deep remedy, beautiful remedy, like caninum children. I'm discovering this remedy more deeply now since I'm writing my book on the psychology of pediatrics. So these children I've seen is, they have inborn maternal instincts towards everyone. So when they are children, they will take a lot of maternal care of the younger sibling. They will feed them. They will wash their potty. No, mama, I will do. And they will just do how mothers do. This is what they are born. Okay? Now, what is behind the maternal care is, they need lot of affection in return. They need lot of care. I'm talking about lack can. But when they don't get it, the mother doesn't acknowledges it, the mother doesn't cares for it, it is here they become very self-critical. And this is where the pathology of the lack caninum child. There's another remedy, lac ovinum. It is made from milk of sheep. Okay, she is also very caring, very nurturing, because for her the central feeling of lac ovinum is ovinum child is, I need my mother, I need my brother, I need everyone. I can't survive alone. So I have to take care of anyone. I'm not able to do, but I have to take it because I can't survive alone. This is the central feeling of lack ovinum. Lycopodium is very responsible towards his family, but his responsibility is very calculated. How? Lycopodium will say, my brother, I will take care of him. My mother will get impressed and I will get extra importance. I will be the boss. I would love to be the boss. I like to take the authority. And this is how lycopodium children speak. Trust me. Aurum is also very responsive. So there are so many remedies which comes into responsibility. So many children, they have a lot of timidity, fear of dark. Calcaria mute children have a lot of anxiety about loved ones. They will always say, Papa, you are still late. Why didn't you come home till now? They will keep on calling. Also, another remedy which comes very close towards the anxiety of loved ones is dull camera child. Okay? Now, the difference is dull camera child is a very, she is like a dadima in the house. Calcaria mule is not a dadima. Calcaria mule is, I am at your service. Dull camera will be like a dadima. Matlab, Papa, why you have not still come? You're okay now. She's dadima. How is dadima? She will take care of everyone. But they are very dominating and they want their thought. Dull camera child, though it is a second number का child, छोटा बच्चा होगा, पर वो बड़े बच्चे को dominate करेगा. He will dominate the young elders. He will dominate his parents. He will take a lot of care of them, yet still they will dominate. Okay? Now these children have history of suppressed skin eruptions. I think we are running out of time. Tendency towards polyps, glandular swelling, chronic catarrh, low immunity, recurrent infections. Okay, they always want to do the right things, but become sad if guided or corrected. Because they feel, do my parent feel I'm not capable or I cannot do it? That's a center field. Because performance comes in calcaria mute. Tendency towards glandular affection. So what is the key takeaway today from this case? Number one is understand the totality, not just the pathology. So, when you go and see nasal polyp, you have remedies like Qcrum, you have remedy like Sapia, right? But do you think if you just give on that, the polyps will vanish? Try to understand the totality of every case. Just don't run after pathology. Number 2, observe the natural dispositions of the child. Just observe. Just see how the child is sitting. What is he doing? What affects the child? What is the child sensitive to? Identify sensitivities. How is he sensitive to reprimand, corrections? What is the sensitivity towards family conflicts? Like children like Ebiscan, children like graphitis, magnesiums, Naxwamika, ignatia. Whenever there are family conflicts, they get highly affected. Calcarea mure will not get much effect, but natrum mure will get more effect. Look for tendencies in the children. Know when to manage acute layers separately. You have to master when you're treating bigger pathological cases in children. You have to master when the child gets acute, what has to be your approach. Okay? Chronic cases improve profoundly with correct constitutional therapy. Focus on that. Okay? So now we'll go on quick clinical tips in pediatric remedy selection. So if you have a child, for example, who is very clingy, whenever he is sick, he just wants his mother. He just wants mother's affection. He's totally dependent on the mother. He will not leave his mother in acute. Think of pulsatilla, phosphorus, calcium. Okay? Now what will be the difference? Now the pulsatilla child will need mother's 100% attention. Doesn't care mother is in that room or not. He wants mother around him, but wants her 100% attention with lot of beta, you will be okay, don't worry, and he will make a bichara wala shakal, not, no beta, you'll be okay now, don't cry babu, I'm there for you. This is pulsatilla wants a conversation and reassurance. And really children say like that. Phosphorus child, whenever he is sick, he also wants mother. But he just wants to hug his mother. He wants to be magnetized. He wants touch. Pulsatilla want emotional touch. Pulsatilla want emotional and mental touch. Phosphorus wants emotional touch. And Calcarea wants physical touch in the mother. That is why they Calcarea is like, if I have to go to potty, how will I do? Mama, you please be with me, huh? Please. Okay? Now, some children, when they come to your clinic, you see them, they are abusive. They are very disrespectful children. They will really use very harsh words or behavior or rude behavior towards the parents. And literally children talk like this. Recently, I was a child. He was constitutionally sulfur child. Now what has happened? Since his birth, I'm treating him. Now he's 5 years old. So he got a younger sibling now. Since he has his younger sibling, it's been 8 months. This child, my patient's attitude has completely changed. He's just abusing his mother. He's abusing his father. Correct? He is getting very angry on them. And father is telling, doctor, he is just coming in my control. He's not listening to anyone. He will just tell mother, hey, I will give you one slap. To grandmother, he just holds the hair of the grandmother and just, he just treats her very bad. He will use abusive language. So the remedy I gave was lycopodium. 2 things. One is his attitude when I saw him was not out of ego. It was not out of haughtiness, but because he thinks he is losing the power in the house. First, he was the center of attraction in the house, but since this younger sibling has come, he is not a center, and he has a subconscious feeling, maybe my power is going. So he is trying to dominate everyone whom he can, but not his father, because his father is strong. So I gave him lycopodium. And interestingly, sulfur was his constitutional remedy since childhood for last 4 years, 5 years. And after sulfur, you can think of lycopodium and see how the mentality of the child changed. If he would have been same the sulfur, he would have been very passionate, taking care of the mother, being very caring for the younger sibling. But no, his gear changed. So this is how his remedy changed. Okay. Now there's a remedy. The child is once. Anguished children during illness. Okay. Very anxious children. Right? You will think, Arey Baba, he's just a 5 years old child. He's so anxious during acute illness. Think of remedy, Athusa. He will just keep crying. So there is a remedy. Athusa is a remedy when mother will say, doctor, he is absolutely okay. The moment the child gets fever, he starts crying for the entire 1 hour till his fever gets down. And when his fever gets down, he's okay. So I gave him Athusa. It worked for him.
Hello, ma'am. There is a message in the chat box.
I'll just check, okay? 1 minute. A patient like this had to be massaged by others. Could you please? You see, that all depends upon what is the remedy, why he needs to be massaged. See, again, we are treating cancer. I have a lot of patients, I'm treating a lot of cancer patients. I'll just give you a tip about cancer. So there are 3 things we can do for a cancer patient. One is just temporary, we can make him feel better. Second thing is what, we can give wrong remedies and spoil the case. And third thing is, you give the right kind of remedy, understanding the right feeling, not here. For cancer patient, you have to go back. Why he got blood cancer? For blood cancer, there is devaluation. Somewhere he is devaluated. So, if he is devaluated, you have to see, you have to take the entire case and then give the remedy. I will not give a comment here for any remedy directly, because the way how I see my cases are very different. Trust me, and I have fabulous results. I'm doing justice to my patient, so this won't be correct from my side. So I will not give any comment. But see, there could be a lot of reasons. Whether he needs massage during acute pain, he needs massage because he has pains out of affection, out of attention. There is something as rubbing amelioration. So there are remedies like cantharides, calcarea, one more remedy. There are only 3 remedies who are better by rubbing. So there are some patients whose nerves are highly sensitive here. They just want to be rubbed. How do we justify it? Okay? So just try to understand why. Go very deep. Don't give superficial remedy to a cancer patient that can trigger his process. Cancer will never happen without a strong internal conflict. There has to be a very great existential conflict happening with the patient. I had a cancer patient who was having cancer of of plasma cells. He was doing well with the remedy. What had happened, he had gone to his native place, and this man, what had happened? This patient, he had a tooth extraction done. After he extracted the tooth, suddenly he got swelling here within 3 days. And then sorry, that is another case. Yes, this man had put new dentures. That was another cancer case. He had put new dentures. After putting the dentures were irritating his gums, And he was telling, Baba, it is irritating me. Please change, please change. So dentist did not change it. And then he got inflammation, and then the whole swelling came up, and it came up with cancer. So what has happened? Did dentures cause this? Extraction of tooth has caused this? Or he and his brothers, this man is 80 years old, 80, wonderful lifestyle. He's a typical Silesia male. Typical Silesia male. Okay? He had a wonderful life story. And then what had happened, with this patient? I'll keep this thing. He had fight with his brother. They had a very big fight for property. And since childhood, he has done a lot for his family. He owned a lot. He gave everything to his brothers also. But for some part of land, they insulted him. They were asking for that property. He felt hurt. And he's a very conscientious man. And they were spreading rumors about him. So everything happened together. His teeth extraction, the dentures irritation, and his image irritation. I gave him Silesia. And with Silesia, his counts came down drastically. Whenever he was going for chemotherapy, after chemotherapy, before he used to collapse and he used to get the strength back after 1-2 weeks, this man was getting it back in 3 to 4 days. His counts were not aggressively growing. Overall, he was much stable, much better, very good. Then he went again to the native place. He had a very big fight. Okay, and all the siblings were just, emotionally fighting with him, and he had a lot of anger. He couldn't express it. He just suppressed his anger, like, what are they doing? Why are they doing? Why they don't understand? And he was just sitting at night. His clavicle bone got fractured. So this is the impact of emotional conflict and distress in our body. There is no exertional fracture. There has to be a reason. यहाँ पर fracture हुआ fine. पैरों में fracture हुआ fine. Even if there is a stress fracture, if there is osteoporosis, is okay. But why here? And why clavicle? What does clavicle signify? Self-respect, emotions suppressed, respect. Then I gave him in that acute condition, because after that again his counts increased. I gave him stapicycline. That man lived for 8 to 9 years. Otherwise, for that condition, the person can live only for 1 year or 2. So this is the depth of prescription when you have to prescribe in the depth to your patients. Okay? Okay. Doctor, how much time we have, Dr. Tripti? 5 minutes we can wind
We
up?
have 8 minutes left. You can continue now.
ठीक है, हम क्या करेंगे, मैं 2-3 और rubrics बताती हूँ, फिर हम wind up. Okay? Children who enjoy contradict. Think of Sana. If you see a child who have no filters, very harsh, very blunt, बदतमीज बच्चा जिसको कहते हैं, think of remedy basilinum. Also see the teeth of the basilinum child, they will have worst teeth. Basilinum and tuberculinum are very similar remedy, but they are not the same. Always doing something, constantly hyperactive child, constantly engaged in activity, think of Sana. Okay? There are some children, they will ask, Mama, I want this bag, I want this dress, I want this game. You give to the child, and then the moment they get it, they will just throw it away. Think of Antim Tart. Creosote is very important. They are the most stupid children. They are such a irritating children. They will cry, I want this, and the moment mother gives, they will just throw it back on the mother. Along with that, their body is offensive smelling. Okay? Okay, very conscientious child, overeating in depression, very sincere child. Whenever they're depressed or sad, they eat more. Carcinosin, very deep remedy, very deep child, carcinosin. Carcinosin child is like the princess, the princess. Cinderella, whenever I think of carcinosin, one thing which comes into my head is Cinderella. When you look at Cinderella, she's been dominated all her life by her stepmother. But she is okay with it. She adjusts. Then she goes to the wedding. The way she looks, she's so graceful. Though she's doing swabbing at home, how beautiful and graceful she is. The way she talks, no hatred, very adjusting. Okay? Carrying grace everywhere, very duty oriented. Again, a very deep level. That's carcinosis. Okay? So before I end up, I just want to talk about, like I keep on taking a lot of webinars. Last webinar series was on case taking. I took 7 lectures. Now I'm coming here up with a webinar series on pediatrics only, where I'm be taking 8 sessions talking only about pediatric materia medica, like how is the mind of carcinosin, what is the mind of Rustock's child, podophyllum child, etc. What is the evolution of these children? What is Eric Erikson method? How you apply to the child psychology? How to take pediatric case taking? Anyone interested? Please give me a mail. Take a screenshot. Keep this number with you. Share it with your group. Anyone interested to learn in depth about pediatrics in a most classical way. Okay? Do not enjoy household tasks. Bromyapcha. Child becomes dull after school. Think of Bovich. Highly loquacious child. We all know. Carcinosis. Lachesis. 1 second. You're being forsaken. This is very interesting. Huh? We always think Pulsarilla is a remedy who has a fear of forsaken. We have borax, silicia, and calcarea. But inner theme of every remedy is more important than just giving on. Okay, and before I end, I just want to give one more important symptom. If you see any child with a very soft skin, feather-like skin, beautiful skin, I want you all to think of the remedy borax. They have feather-like skin, beautiful skin. You just touch and it's like woogly bush karke hum kehte hain. That is it. So this is all I have. I'll just take a picture with you all. So this is all about my today's lecture. If you have any queries, please let me know. I will help you solve it. Yeah. I hope you all liked it.
Yes, ma'am, we liked your session, and a very thank you and congratulations for the informative session.
Thank you.
As we all know about how a child reacts and the nasal polyp and differentiation about different remedies, especially calcarea muse. For me, to knowing calcarea muse is very informative.
I have I have so much remedies to talk about in pediatrics. I don't know how to. I will talk a lot on so many different aspects. Spongia child. I mean, what is a spongia child? How to know this is a spongia child? Not too respiratory. Okay, I'm talking about the psychodynamics of the child. What is the mind of Rustock's child? I mean, if you catch this is the best thing you can do now in your practice, right?
Ma'am, someone is asking about the Fable webinar in chat box.
Yeah, tell them na, my number I'm putting. Just ask them to message
you can text, yes.
Please note this number.
Already the number has been said in the poster.
Yes.
Everybody can take it from the poster.
But I'll tell you, this will be very useful, my webinar sessions. I enjoy teaching. That's it. Marke sab leke nahi jana hai na bahar. We should give it to others also, right?
Yes.
Right. If I die, I'll take all the information. What's the point? You should always share it.
We can invite Dr. Subaida Salam to say vote of thanks.
Yeah.
Dr. Subaida?
Yes, ma'am. Yes, sir.
Dr. Subaida, please unmute. Yes, madam.
Good evening. It's a surprise that they called me suddenly. I'm not at all actually prepared for you know, Thanksgiving. But anyhow, I am supposed to give. It's a very excellent class and very excellent presentation, very informative. Thank you very much, Doctor, and for the others also who are attending this program. I thank you very much for this such an excellent presentation. Thank you. Thank you.
Thank you, ma'am. Here we ending our session as the time we are getting late for the next session. So we are handling to the Malayalam team.